In posterior rhinoscopy, we have to observe if there is a choanal polyp or atresia or hypertrophy of posterior ends of inferior turbinates, discharge in middle meatus. It is seen in infections of maxillary, frontal, and ethmoidal sinuses. Discharge above the middle turbinate indicates infection of posterior ethmoid or sphenoid sinuses. This is the image showing posterior rhinoscopy. This is the procedure of anterior rhinoscopy using a Vienna speculum. Functional examination of nose. It is done by testing patency of nose and sense of smell. Patency of nose is tested by spatula test or cotton wool test. Spatula test, in this a clean cold tongue depressor is held below the nostrils to look for the area of mist formation when the patient exhales. The two sides are accompanied. Cotton wool test. In this, a fluff of cotton is held against each nostril and its movement are noticed when patient inhales or exhales. Sense of smell. It is a simple test to ask the patient to identify the smell of a solution or a substance held before the nostril while keeping his eyes closed. Each nostril is tested separately. Common substances used in this are clove oil, peppermint, coffee or rose essence. Ammonia stimulates the fibers of cranial nerve 5 and it is not used to test the sense of smell. Now, examination of paranasal sinuses. In this, we examine for the following sinuses: maxillary, frontal, ethmoidal, and sphenoid. This is the way we examine for maxillary sinus. It can be examined by inspection, palpation, and transillumination. Maxillary sinus has 5 walls, and except for the posterior wall, all others are examined directly. We have to examine the soft tissues of cheek, lip, lower eyelid and molar region, the orbit and its contents and the vision, vestibule of mouth by everting the lip, upper alveolus, teeth and palate, the nose by anterior and posterior rhinoscopy, and tenderness by pressuring over the canine. This is transillumination of maxillary sinus, which is done by placing a specially made light source centrally in the mouth and closing the lips. This is examination of frontal sinus. This can also be examined by inspection, palpation and transillumination. It has 3 walls: anterior, posterior and floor. The anterior wall and floor lend themselves into external examination. So there are 2 types of examination: external examination and examination of nose. In external examination, we should examine the forehead, root of nose, orbital margins and orbit its contents. We should look for redness, swelling, fistula, proptosis and displacement of eyeballs. Tenderness in frontal sinus can be elicited by pressuring or percussing with a finger on its anterior wall above the medial part of eyebrow, or by pressing upwards on its floor in the medial canthus. Now, examination of nose. Nose in this should be examined by anterior and posterior rhinoscopy for evidence of discharge in the middle meatus or for any neoplasm. Ethmoidal sinus. It is divided into 2 groups, anterior and posterior. Former drains below the middle turbinate and latter above it. They are examined by inspection and palpation. In this, tenderness can be elicited only in the anterior ethmoidal sinus. It is done by putting gentle pressure on the medial wall of orbit just behind root of the nose. Nasal examination. Anterior rhinoscopy might reveal things like pus, polyps, growth in the middle meatus or between the middle turbinate and the septum. For this, probe test should be done, and also posterior rhinoscopy may reveal pus or growth below or above the middle turbinate. Sphenoidal sinus. In this, the two techniques used are anterior rhinoscopy and posterior rhinoscopy. In anterior rhinoscopy, sphenoid sinus opens into sphenoethmoidal recess. Attention should be therefore paid in the findings in olfactory fissure near the roof of the nose. It may show discharge, crusts, polyp or growth. A probe can be used to palpate the mass. Posterior rhinoscopy. In this, it may reveal pus in the nasopharynx or the choana above the middle or superior turbinate. A growth or a polyp may also be seen. This is nasal speculum. They are basically of two types, Thudicum and Vienna. The size of nasal speculum is selected according to the age of the patient and size of the nostril.